My name is Dr. Chan. I'm a Dean of Admissions here at the University of Utah School of Medicine. Today I'm here to talk to you about our MD, PhD joint program. Really excited to talk about this. All right, so let's talk about the process. So it's exactly the same as applying to the regular MD program, except you have to write 2 additional essays, and they really focus on your research. When you apply to MCAS, you can check MD or MD, PhD, so that'd be an option. Not all medical schools have an MD, PhD option, so that's something you should look into. If you really want to go to med school in blank, you should make sure that there's an MD, PhD program that's interested in you. Most programs, including ours, interview you separately. On the first day, you interview with the PhD people. On the second day, you interview with the MD people. And MD, PhD programs are only open to US citizens or permanent residents. So my tip for you as an MD, PhD applicant, you have to be very strong in research. Multiple publications are extremely helpful. You also need to clearly explain why MD and not just PhD. It's kind of a paradox what I'm talking about here. So if you have multiple research publications, the question that the MD committee is going to ask is, why doesn't this person just apply to a PhD program, right? So if you're an MD, PhD applicant, you need to have really strong research, but also demonstrate your humanitarian side. You need to have community service. You need to show you like to help patients. You have good communication skills. Why is it important to have good communication skills? Well, as future physicians, we have to explain difficult concepts to patients. Why do we recommend this procedure? Why do we want to start this medication? So we need to see these skills in all our applicants, but especially our MD, PhD applicants. So you got to be committed. Why? It's a much longer journey. So the way it works for MD, PhD, you spend your first 2 years in med school, and then you step off after your second year of med school, and then you spend the next 3 to 6 years pursuing your research. You more or less get your PhD during that time. And then after your 3 to 6 years out in the wilderness getting your PhD, you come back for the last 2 years for your clinical rotations in medical school. So 2 years med school, 3 to 6 years PhD, 2 years back in med school. So this could conceivably be a 7 to 10 year program. All right, other aspects about the program. In many ways, it's great. They provide a stipend for you. They cover your tuition, books, other related expenses for the next 7 to 10 years. That's a huge positive. For many applicants, they're very attracted to that. They love science, they love being a research scientist, and they like the idea of not having to be in debt when they graduate school. I totally get that. However, there's some other negatives to it, I would say. You know, when you start medical school, you're with everyone else, and then after 2 years, you have to say goodbye, because the second years become third years, and they're going to graduate many years before you do. So you have to say goodbye to your classmates at the end of your second year. And then when you re-enter the med school curriculum, you have to say hello to a bunch of third and fourth years you don't necessarily know. So sometimes there's that can be rough, that transition. Let's pretend you start down the path of MD, PhD, and you just don't like it. You know, the PhD is not what you thought you can be. Depending on the school, there's a mechanism for you to switch from MD, PhD back to MD, but you're going to have to pay the PhD program back, right? They covered your stipend, they covered your tuition, all that. They're going to want that money back, all right? So that's another negative. When you commit down to the path, you sign these promises that if you don't complete the path, you might have to reimburse the PhD program. Okay, this is a presentation about our MD, PhD program. I look forward to seeing your applications. Thank you.